Dr. Li Wenliang was an ordinary ophthalmologist in Wuhan, treating pink eye and cataracts, when he saw something that would change the world. On December 30, 2019, he sent a message to 7 colleagues, warning about a SARS-like virus in his hospital. 34 days later, Chinese police forced him to sign a confession, calling him a liar, spreading rumors. 40 days after that, he was dead from the virus he tried to warn the world about. Some heroes don't wear capes, they wear face masks that couldn't save them. Dr. Li Wenliang adjusts his glasses and peers into the examination light, checking his patient's eye for signs of infection. At 33, he's an ophthalmologist at Wuhan Central Hospital, specializing in glaucoma and routine eye problems. Nothing dramatic, nothing life-threatening, just helping people see better. It's December 30, 2019, winter in Wuhan, cold and gray. Li finishes his afternoon shift, changes out of his white coat, and checks his phone. A message from a medical school colleague catches his attention. "Li, have you heard about the pneumonia cases at your hospital? ICU has 7 patients. They say it's SARS." Li's blood runs cold. SARS, severe acute respiratory syndrome, the virus that killed 774 people in 2003, caused worldwide panic, devastated China's economy. If SARS is back, he walks to the ICU, speaks quietly with a nurse he knows. "The pneumonia patients, what's their status?" The nurse looks around nervously before answering. 7 cases, all connected to Huanan seafood market. Fever, dry cough, breathing difficulties. "We're running tests. Dr. Li, they've been isolated. Don't spread this around. Is it SARS? The test results aren't back yet. But the symptoms." She doesn't finish. Li returns to his office. His mind races. 7 cases of severe pneumonia, all from the same location, showing SARS-like symptoms. This could be an outbreak. People need to know. Healthcare workers need to take precautions. At 5:43 p.m., Li opens WeChat, China's primary messaging app. He sends a message to a private group of 7 medical school classmates, all doctors. 7 confirmed cases of SARS at Huanan seafood market. Be careful. Virus isolated in ICU. Tell your families to take precautions. He includes screenshots of patient test results, with identifying information removed. It's not panic-mongering. It's professional courtesy, warning colleagues to protect themselves and their families. His friend Dr. Shi responds immediately. "Are you sure it's SARS? The symptoms match. Tests pending. But be careful." Li goes home to his wife, Fu Hui, pregnant with their 2nd child. Their son Yu Yenyuan is 5 years old, playing with toys in the living room. "There's some unusual pneumonia cases at the hospital. I told some colleagues to be careful. Should we be worried? Probably not. Just a precaution." But that night, Li can't sleep. He thinks about SARS in 2003, the panic, the deaths, the economic collapse. If this is SARS or something similar, early warning could save lives. He made the right choice telling his colleagues. December 31, 2019, Li wakes to dozens of messages. His private group chat has leaked. Screenshots of his warning have spread across Chinese social media. Thousands of people are sharing it. The message has gone viral. By noon, he's summoned to the hospital administration office. "Dr. Li, did you send messages about SARS cases? I warned some colleagues about unusual pneumonia cases. As a precaution, you've created panic. There is no SARS. You spread rumors without authorization. I'm a doctor. I saw concerning cases. I warned people. You violated protocol. Official announcements come from the Health Commission, not individual doctors. You've caused unnecessary alarm." That evening, Wuhan Health Commission releases a statement. 27 cases of viral pneumonia identified. No clear evidence of human-to-human transmission. The situation is under control. Li reads this and feels uneasy. No human-to-human transmission, but all 7 cases were linked. And why has the number jumped to 27 if the situation is under control? January 1, 2020. Wuhan seafood market is closed and disinfected. Officials claim it's routine. January 3, 2020. At 1:30 p.m., Li is summoned to Wuhan Public Security Bureau. 2 police officers are waiting. "Dr. Li Wenling, yes, you're being investigated for spreading false information online." They take him to an interrogation room. For 2 hours, they question him about his WeChat messages. "Did you send messages claiming there was a SARS outbreak?" "I sent a private message to medical colleagues, warning about unusual pneumonia cases. You caused public panic. You spread rumors." "I'm a doctor. I warned people about a potential health risk. You are not authorized to make public health announcements. You violated the law on prevention and control of infectious diseases." They present him with a document. "Letter of admonishment. Sign this. Admit you spread false information. Promise not to do it again." Li reads it. The letter accuses him of making false comments on the internet and severely disrupting social order. It demands he cease illegal activity. If I don't sign, then we proceed with formal charges. Criminal prosecution. Do you want that? Li thinks of Fu Hui, pregnant, of Yuan Wen, 5 years old, of his career. He signs. Can I return to work? Yes, but no more rumors. Understand? I understand. Li returns to the hospital, humiliated and angry. He warned people about a health risk and got punished for it. Meanwhile, cases are multiplying. The ICU is filling up, but officially, there's no cause for alarm. January 10, 2020. Li treats a patient with glaucoma. The patient seems healthy, no fever, no cough. Routine appointment. 3 days later, Li develops a cough. Probably nothing. He's a doctor. He's exposed to sick people constantly. January 14, 2020. Fever. He checks himself into Wuhan Central Hospital as a patient. The test results come back positive for the novel coronavirus, the virus he tried to warn people about. Li is isolated. Medical staff treat him while wearing full protective gear. The irony is bitter. He was punished for warning about this, and now he has it. Fu Hui and Yudin Yuang are quarantined at home. Fu Hui is 7 months pregnant and terrified. Will you be okay? She asks over video call. I'm young and healthy. I'll be fine, Li lies. He's seen what this virus does. He's watched patients deteriorate rapidly. January 20th. Dr. Zhongnan Shan, China's top respiratory expert, the doctor who helped defeat SARS in 2003, finally confirms what Li knew 3 weeks ago. Human-to-human transmission is happening. The virus is spreading rapidly. Wuhan goes into lockdown on January 23. 11 million people confined to their homes. The city that punished Li for spreading rumors is now sealed off from the world. From his hospital bed, Li watches the news. The virus he tried to warn about is now a global emergency. Cases in Thailand, Japan, South Korea, United States. The WHO is investigating. He posts on Weibo, China's Twitter. The authorities made me sign a false confession. I wanted to warn people. Now I have the virus. The truth cannot be silenced forever. His post goes viral. Millions read it. Suddenly, Li Wenliang is not a rumor monger. He's a whistleblower, a hero who tried to warn the world. International media picks up his story. CNN, BBC, the New York Times. The doctor China silenced is now fighting for his life. But Li isn't thinking about media attention. He's fighting to breathe. The virus has attacked his lungs. He needs supplemental oxygen. Each breath is a struggle. February 4/20. Li's condition deteriorates. Pneumonia spreading. Doctors intubate him, connect him to a ventilator. He can no longer speak, can only communicate through text messages when conscious. He messages Fu Hui, take care of Yuan. Take care of yourself and the baby. I'm sorry. Don't talk like that. You're going to be fine. But they both know he might not be. February 6, 2020. Li's heart stops at 9:30 p.m. Doctors perform CPR, use a defibrillator, fight for hours to save him. At 2:58 a.m. on February 7, they finally stop. Li Wenliang is dead at age 33. Cause of death, COVID-19. The virus he tried to warn the world about. News of his death sparks outrage across China. Millions post tributes online. We want freedom of speech. Li Wenliang was a hero. The government killed him. The anger is so intense that authorities briefly delete death announcements, creating confusion about whether Li is actually dead. But the truth cannot be hidden. Fu Hui gives birth to their second child in June 2020. A boy. She names him after Li's chosen name for him. But the child will never know his father. The Chinese government, facing massive public outcry, declares Li a martyr in April 2020. The same authorities who forced him to sign a false confession now praise him as a hero, but Li never wanted to be a martyr. He just wanted people to be safe. By March 2020, COVID-19 is a global pandemic. Millions infected, hundreds of thousands dead, economies collapsing, countries in lockdown. And it all might have been different if someone had listened to Li Wenliang on December 30, 2019. Dr. Ai Fen, another Wuhan doctor who tried to warn about the virus, said later, if only they had listened to Li Wenliang. If only they had taken action when he warned us. How many lives could have been saved? The answer is unknowable. But epidemiologists estimate that early intervention could have reduced the outbreak by 95%. If authorities had acted on Li's warning immediately, locked down Wuhan in early January, instead of late January, implemented testing and tracing, the virus might have been contained. Instead, 5 million people left Wuhan for Chinese New Year celebrations before the lockdown, spreading the virus across China and the world. Li's legacy is complex. In China, he's celebrated as a hero, but also a reminder of government failures. His face appears on murals. His name trends on social media every February 7th. But discussions of what he represents, free speech, government accountability,
are still censored. Internationally, Li became a symbol, not just of the pandemic's origins, but of the cost of silencing truth-tellers, of what happens when politics overrides public health. Wuhan Central Hospital, where Li worked, lost 4 doctors to COVID-19 in early 2020. Li was the youngest. His colleagues remember him as quiet, dedicated, someone who just wanted to help people see better. He wasn't trying to be a hero, says a fellow ophthalmologist. He just saw something wrong and told people, that's what doctors should do. 3 years after Li's death, COVID-19 has killed over 7 million people globally. The exact origin remains debated: wet market, lab leak, natural spillover. But what's certain is that early warnings were ignored. Li Wenliang sent his message on December 30, 2019. If authorities had investigated immediately, if they had warned the public, if they had implemented containment measures, the trajectory of human history would be different. Instead, they silenced him, and the cost was measured in millions of lives. Fu Hui rarely gives interviews, but on the 3rd anniversary of Li's death, she spoke to a Chinese journalist. He wasn't a politician. He wasn't an activist. He was just a good doctor who cared about people. He saw something dangerous and warned his friends. That's all. They made him sign that paper saying he was wrong. But he wasn't wrong, and now he's gone. Do you blame the government? What good would that do? It won't bring him back. It won't change what happened. But I hope people remember him. Remember that speaking truth has a cost, and silence has an even greater cost. Li's son Yuan is now 9 years old. He asks about his father sometimes. Was Baba a hero? He was a doctor, Fu Hui tells him. A good doctor who tried to help people. That's the best kind of hero. The letter of admonishment that Li was forced to sign has been officially withdrawn. The Wuhan police posted an apology. We solemnly apologize to Dr. Li Wenliang, but apologies don't resurrect the dead. On February 7th each year, Li's Weibo account receives millions of messages. People from around the world post tributes. Thank you for trying to warn us. You were right. They were wrong. Rest in peace, hero. We will remember. Perhaps the most poignant was from another Chinese doctor. You were punished for speaking. I am alive because you spoke. Thank you. Dr. Li Wenliang never wanted to be famous. He wanted to treat eye diseases, raise his children, live a quiet life, but history had different plans. He saw something wrong and said something. In a society that demanded silence, he whispered a warning. And for that, he was punished, silenced, and ultimately killed by the very thing he tried to warn about. The question that haunts anyone who learns his story is simple. How many other Li Wenliangs are out there? How many people see something wrong, know they should speak, but remember what happened to the ophthalmologist from Wuhan? And how many pandemics, disasters, and tragedies might be prevented if people felt safe to speak truth to power? Li Wenliang's legacy is not just about COVID-19. It's about the cost of silence and the price of truth. It's about what happens when authorities prioritize control over safety, when politics override science, when silencing dissent becomes more important than protecting citizens. He was 33 years old, an eye doctor, a husband, a father, a man who sent a message to 7 friends and accidentally changed the world. The whistle has been blown, the warning was given, but it came too late, and the messenger paid the ultimate price. Every time someone speaks up about danger and is silenced, Li Wenliang's story echoes. Every time an expert warning is dismissed for political reasons, Li Wenliang's story echoes. Every time truth is labeled as rumor, Li Wenliang's story echoes. He is dead, but his message lives on. Speak anyway, warn anyway, tell the truth anyway, because silence is not safety, it's just death arriving unannounced.